If you thought the buzz around weight loss drugs like Ozempic and Wegovy was huge, well, you haven't seen anything yet. What we're watching unfold isn't the end of a medical revolution. It's actually the first shot in a full-blown pharmaceutical arms race. Let's dive in.
So is Wegovy the finish line? I mean, for millions of people, it sure felt like it, right? The arrival of these super effective GLP-1 drugs seemed like the destination. But for the world's biggest drug makers, it wasn't the finish line at all. For them, the massive success of these first-generation treatments just fired the starting pistol on a whole new competition to create something even more powerful, more convenient, and more effective.
And this new battlefield, well, it has two clear titans right at the center. They're locked in this high-stakes rivalry to define the future of obesity treatment for a global market of, get this, over 1 billion people.
Okay, so on one side, you've got Novo Nordisk. They're the Danish giant, the ones who pioneered this whole single hormone approach. And on the other, you have the American challenger, Eli Lilly, which is just racing ahead, developing a whole new class of multi-hormone therapies. And this brings us to the first major front in this war, the power offensive.
The main goal here is pretty simple. Achieve a level of weight loss that, until now, was really only possible through surgery. And they're doing it by engineering drugs that target our body's own biology in new and incredibly powerful ways.
All right, so how does this actually work? It's a pretty fascinating evolution. The first wave of drugs, they targeted just one hormone receptor. The next generation targets 2. And the cutting-edge stuff, well, that's the new frontier. They're hitting 3 at once. Let's break down what these targets actually are.
Everything starts with GLP-1. This is the foundation, right? It's the hormone that Ozempic and Wegovy target. It basically tells your brain that you're full and slows down your digestion. It's a powerful 1-2 punch for appetite control. But what happens when you start adding more tools to the toolkit?
Well, by adding GIP and glucagon into the mix, scientists create this incredible synergistic effect. It doesn't just curb your appetite anymore, it can also increase how much energy your body burns. And this is where the numbers get truly dramatic. Let's start with our baseline. The first generation of these drugs, like Wegovy, they delivered a groundbreaking average weight loss of around 15%. And at the time, this was a phenomenal achievement. But it was just the beginning. Then comes the dual agonist leap. Novo Nordisk's CagriSema combines GLP-1 with another hormone, and that pushes the average weight loss all the way up to about 23%, a huge leap forward. But it doesn't stop there. And this is the new frontier. Eli Lilly's retatrutide is a triple agonist, hitting 3 hormone receptors at the same time. The result? A staggering 28.7% average weight loss. I mean, that is efficacy that actually rivals bariatric surgery, but with a simple injection. But, raw power isn't the only front in this arms race. The second major offensive is all about convenience. Because let's be real, not everyone wants to take a weekly injection for the rest of their life. So the company that can solve this needle fatigue problem is going to have a massive advantage. And here, we're seeing 2 different strategies play out. Eli Lilly is developing a once-daily pill that gives you significant weight loss with fewer restrictions. Meanwhile, a company like Amgen is developing a powerful injection you might only need once a month. It's not just about what the drug does anymore, but how easily it fits into a patient's life. And while Novo Nordisk and Eli Lilly are dominating the headlines, they are definitely not alone on this battlefield. The sheer size of this potential market has attracted a whole host of other competitors, each with their own unique strategies. Companies like Amgen, Altimmune, Boehringer Ingelheim, and Innovent Biologics are all throwing their hats in the ring. And honestly, this intense competition is fantastic news for patients because it's likely to accelerate innovation, increase the variety of treatment options, and hopefully, eventually, drive down costs.
So with all this innovation happening at lightning speed, what does the end game actually look like? And what are the major hurdles that still need to be overcome?
One of the most important things to understand is that these aren't short-term fixes. Obesity is a chronic disease, and these are long-term treatments. There's this concept of the stickiness of the drugs, which means that when you stop taking them, the weight often comes back. This reality shapes the entire market and leads to some pretty significant long-term challenges.
And those challenges are substantial. First, can these companies physically produce enough of these complex drugs to meet the staggering global demand? We've already seen shortages. Second, accessibility. Will these treatments be affordable and covered by insurance for the millions who need them? And third, a crucial medical question, what is the quality of the weight being lost? It is absolutely vital to make sure patients are losing fat while preserving essential muscle and bone mass for their long-term health.
And this brings us to our final big question. We are on the cusp of a new era, where a weekly shot or a daily pill can produce results comparable to major surgery. Think about that. This isn't just a medical breakthrough, it's a societal one. How we view, discuss, and treat obesity is about to be fundamentally transformed, and the aftershocks of this arms race will be felt for decades to come.